The following is an encore presentation of a pre-recorded program. To join one of our many live presentations, please visit cje.net/events, call 773-508-1000, or follow us on your favorite social media platform.
Good morning. My name's Roseanne Corcoran. I'm manager of CJE SeniorLife's Counseling Services. It's my pleasure to welcome you to this Insights on Aging program on providing care to people living with dementia. This is the second part of a two-part series. The first part of this program was brain and behavior changes with dementia. It was recorded and it is available on CJE's website, as are all of our other Insights on Aging programs. If you're participating live in our program today, the link to this recording will be shared in the chat. These monthly community education programs are part of an effort by CJE and our Counseling Services program to highlight important aging and mental health issues. We hope to provide essential information to the individuals and families that we serve. If you have ideas about other programming and information that we should offer, please let us know. In case you're not aware, CJE's Counseling Services does offer a full range of older adult behavioral health services. These services include individual supportive counseling, psychotherapy, support groups, as well as caregiver and family support. All of these services are presently available through telehealth, either online with video or on the telephone. And we're also now offering some limited face-to-face sessions on a case-by-case basis. Since this program is being recorded to be shared publicly, there are higher privacy features in place, and your live participation will be anonymous. You'll not be able to see other participants, and when you use the Q&A feature, your name will not be shared. Our speaker will talk for the first 45 minutes of the presentation, and then she will take questions from participants at the end of the program. If you're participating live in the presentation today, you can use the Q&A box at the bottom of your screen to ask your questions. The PowerPoint presentation that you'll see during the program will be shared with those of you who are participating in its original air date. Let me now introduce our speaker, Christie Norrick, Project Manager in CJE's Leonard Schanfield Research Institute. Christie.
Good morning, everyone. Thank you so much for having me today. I'm excited to talk with everyone and share some information and hear from you. I'm going to start by sharing my slides to get us started. All right. So today we are going to focus on activities of daily living and providing that hands-on support to a person living with dementia. The information that I'm sharing comes from the Positive Approach to Care, which is a model of care that was developed by Teepa Snow, who's an occupational therapist. We're going to watch some videos featuring Teepa, and I think you'll get a good idea of her perspective. So today we're going to start by talking about methods that you can use when you're partnering during hands-on care for a person living with dementia. We're also going to talk a little bit about meaningful activities, how to include those in a person's life in a way that is going to be successful. I'll share some resources, and then we'll have some discussion time at the end, like Roseanne mentioned. So at any point during the presentation, if you have a question or comment, you can use the Q&A feature. All right, so first I wanted to share some definitions. A lot of times medical or other healthcare professionals are going to talk about activities of daily living or instrumental activities of daily living. And so those ADLs are the most essential things that we have to do each day just to keep our bodies going. So they include eating, walking, going to the bathroom, using the toilet. As a person's dementia progresses, they may need assistance with these. And there are some older adults who don't have dementia who need assistance with these for other reasons. The same thing is true with instrumental activities of daily living. So things like paying the bills, cooking yourself dinner, cleaning up the house. Again, those are usually a little bit more complicated, and so a person may need assistance with those IADLs sooner than with the ADLs, depending on their other health conditions and so forth. But I also want to mention general activities that are meaningful to a person. So these can be any sort of different activity that a person can be successful at and finds engaging. Again, the emphasis is on engaging and meaningful. So these are activities that include, gardening, building a puzzle, maybe taking a walk outside. One person may really enjoy playing bingo. Another person may not. Neither one of those people has to play bingo in order to just keep their body going the way they need to perform ADLs. But if you have a life that doesn't include any of those fun things that are engaging and it's only concentrated about ADLs, most of us aren't going to find that to be a very satisfying way to live. So we have a number of videos that we are going to watch today. And I'm just going to ask for everybody's patience while we are zipping between the different screens. It does just take a moment to pull up the video and get it to be full screen. So bear with me, please. So this first video is the longest video that we will watch, but it features Teepa Snow providing that perspective that will really, I think, frame the rest of our conversation today around how we can be care partners with a person living with dementia.
Challenging behaviors, that's how we see it. They're misbehaving. They have problem behaviors. We've got to do something about this. Now, I'm going to call a timeout right now because the biggest problem we have right here is you've already identified the source of the behavior. You're pretty sure it's them and what they're doing. Timeout. You need to take a step back and realize this is much more complicated than you think. And instead of being such a strong judge and jumping to conclusions, what I want you to do is back off and reframe this. I want you to realize that they're doing the very best they can to try to communicate with you, to meet a need, to express that they aren't liking what you're doing. And unfortunately, you simply see it as not getting your way. What you don't realize is that you started this very frequently in your effort to be helpful. Let me just say to you, you weren't as helpful as you thought you were. I didn't really enjoy the help you gave me. I didn't get it. So you have a choice right now. Are you going to continue to push your agenda to try to get where you want? Or can you take that step back and go, okay, well, this isn't working. Let me rethink. So what you want to do when you experience a behavior you're not liking, you need to, take that step back. Take a deep breath. Let it go and realize now it's time to kick in the front of your brain and to become a really good detective. Try to figure out what might be driving what you're seeing, what you're hearing, what you're feeling, and what they're feeling. What maybe you're smelling and they're not picking up on, what they're tasting versus what you would be tasting. Because what you want to do is realize that you need to see it from their side. And once you see it from their side, you try to be in their shoes, figure this out. Suddenly, when you see things, hear things, experience things differently, and you make that choice, that decision to do that, the uh-oh becomes an aha, because you can start to realize it's the setting, it's the care, it's the gem. It's who they were before this all started. There's lots of pieces to the puzzle. Your job, if you want to do this well and do this over the course of this condition, is to stop the judgment, time yourself out, and reframe this behavior. Go from a challenging and frustrating, I just don't understand why she's doing this, to pausing for yourself, getting some help, maybe getting somebody else to take a look with you, because maybe you just can't see it because of who you are and how it works. But what you're going to do is take that step back, look more broadly, and at that point, make a decision. What are they trying to do? Are they communicating unmet physical need? There's basically 5 of them you want to learn about. Or an unmet emotional need. Or are you seeing the emotional need, but you're missing the physical need? Or was it something that is happening in the environment or happened earlier today? As I said, complicated. So you need some training. You need to know what's going on and what's not going on so you can quit sitting in judgment and start using this. That's the best tool. That and your ability to bring people together to help you. So with challenging behaviors, it's not about them. It's about us and what we choose to do about this effort to communicate an unmet need and helping us figure out what is the need and how can we better meet it for success for both of us. Making a positive difference because we choose positive approach to the care. Now remember this lady? What do you think she's doing? You see her beating on the chairs, making noise, annoying people, and you know she needs to go to the bathroom. It's been a long time. You've tried to make her stop, but she won't. What if I told you she used to clean houses for a living? I'm going to try substitution and a positive approach rather than trying to make her quit.
Miss Leona. Well, hey there.
Get your hand.
Get my hand out the way. You're trying to get him cleaned. Here, try this.
She's a busy woman.
There you go.
I'm going to
that.
try a substitution here.
I'll trade you.
Not yet. Show her.
Rub it with that. Can you rub it?
Yeah.
Here, rub
We're
it.
getting there.
Trade me.
Wait.
Trade me. Here you go. Take this.
All right, get it.
You got it. Now trade out. There you go.
Ta-da.
Now rub it.
Now I show her, and there she goes.
There we go.
People
Good.
are less annoyed, not
Perfect.
so much noise. And she's
Beautiful.
cleaning. Now I want to reinforce it. That's
Got
good. That's good.
2 more to go.
I still haven't met
You're doing a fantastic job.
her unmet need. One more substitution.
Nicely done, Leona.
She needs to get finished with this
Boy, you are good.
so we can move on.
You get this one?
Watch me, I'm sneaky.
That's it. Good. Good.
I visually eliminate the task.
Whoa. Woo. That is beautiful. You did a fantastic job. Man, you're a good cleaner.
Here.
Thank you. All right, well, come with me and we'll sit down and take a break.
Oh, God.
I know you're ready for
I'm
one, aren't you?
tired.
Now,
Oh,
before
boy.
she goes to sit
You're
down,
wore
though,
out.
we have a place to go.
Oh, girl, you worked hard.
Oh, God.
You are one of the hardest working women I've ever met.
Yeah. Uh-huh.
Well, Lord knows. Let's go to the ladies before we sit down, though.
Okay.
Okay.
We changed the challenge to success.
All right, so hopefully that was helpful. And again, I don't want to have it come on too strong and make anybody feel like, we're saying that you have been judging the person that you might be caring for living with dementia, but it's piggybacking on the part 1 of this series, where we really emphasized that a person living with dementia is often doing the very best they can, and because of the changes in their brain, they are not doing what you want them to do, or they're not being cooperative, or they're not acting in ways that we would anticipate. And so the goal of today's presentation is really to try to help family members and other care partners think of some new strategies that might make these daily activities, daily routines easier and more successful for both the care partner and the person living with dementia. And so again, like in that video that we just saw, Teepa demonstrated several of the things that we talked about in that first presentation in terms of communication strategies, trying to be on the person's eye level, not having a confrontational stance, but being a little bit to the side, while at the same time making sure she's in their visual field, using a lot of body language and visual cues, as opposed to expecting a person to be able to comprehend a lot of complicated language. One of the other things that she was talking about was that it can be complicated to figure out what is driving a person's behavior. And again, to a person who's trying to partner with them to provide some care, it can be frustrating when we don't know why they're responding the way they are. And so one of the ideas that she mentioned were, all of these different pieces of the puzzle that can help us understand why a person is behaving the way they are. So the first one is obviously that individual person. Who are they? What has their life been like up to this point? Did they have early onset Alzheimer's or a different type of dementia? Again, the brain changes, stage type are also important. But when we think about a person's roles that they have inhabited, think about someone who maybe was a full-time homemaker, raised children, did all the cooking and cleaning, so forth. It's going to be different to provide care in a home-based setting to that individual who may have a harder time relinquishing that responsibility and feeling comfortable with someone else taking over those instrumental activities of daily living than it would be for someone who's maybe had a career outside the home and was used to having a spouse or someone else who was doing a lot of that home-based activity. So we would just want to be thinking about those different things and what does this person's background really inform us to do. Again, in addition to the specific brain changes and the symptoms that person might be having, we need to think about the stakeholders in this situation. Do we have a team of care partners who are highly trained, highly skilled, and bringing a lot of knowledge to the table? Or maybe do we have some friends of the person living with dementia who really want to be there and spend time with the person, but aren't exactly sure what to do or how to help? So we really want to think about, who's at the table, are those the right people, and what are their interactions really going to feel like to the person living with dementia. The environment is really, really, really important. We're going to keep coming back to that during this presentation. So the 4 F's are: we want the area to be friendly, familiar, functional, and forgiving. I'm going to talk more about a couple of those in a moment, but again, we think about what it would feel like for a person to be in their own home when they were asked to do something that was challenging versus being in a place they'd never been before, didn't recognize, with strangers, with distracting TVs on in a waiting room. Their ability to respond and their ability to complete the tasks may be really different in those 2 different environments. We also really want to think about how they are going to interpret what's going on in the space, both the physical things and the social interactions. I do want to emphasize the sensations and surfaces. So really thinking about, what does the carpet feel like under their feet? What is the tabletop or the tablecloth like? The sound, the smells. If there's a person who's not eating well, first we eat the meal with our nose, right? Before we eat it with our mouth. And same thing with our eyes, right? How are we really trying to engage all of the senses to make mealtime as successful as possible? So here's a little snapshot related to the physical environment with a couple of things to point out. we want things to be functional, like we said. So we're not going to have little carpets that could be a trip hazard. We're going to include a night light. We are going to have a large clock, if that is something that a person is eager to know what time it is, make that really useful for them. For some people with dementia, mirrors and other reflective surfaces can be either distracting or sometimes even scary if they are not recognizing what's being reflected, and that can contribute to disorientation in the physical space. So being mindful about not having things that are going to create that reaction. For a lot of people, things like photographs from a long time ago, like a person's wedding photos, might be something that they're more easily able to place and hold on to in their mind and feel more comfortable when they're seeing. And again, lighting, I'll mention that probably several times, even for people without any visual impairments. Just we need more light as we get older, and especially for people with dementia who may have a harder time interpreting the world around them and what they're seeing, making sense of that in their brain, more light. Oh, I would also just like to mention there's a whole lot more of those pictures on the Dementia Friendly Home website. So if you want more ideas and more specifics for different parts of the home, I would encourage you to check out that website. Next, we also need to think about the person's wellness, health, and fitness. So, in addition to dementia, do they have any other chronic conditions? Do they have any acute illnesses? When do they take their medications, and when do those medications seem to have the most impact with managing symptoms? Are they eating well? Are they drinking enough water? Are they someone who still has the stamina and likes to be physically active? And maybe we need to be really mindful of that to make sure that they have opportunities to exercise so that they don't get agitated and perhaps wander, or really thinking about all of those bodily needs. And then the last part is time. So again, this can be tricky, but what we want to try to do is see it from that person's perspective. And so based on their behavior, we may be able to figure out, are they oriented to the here and now, or are they more in tune with a previous time in their life? Are they confused about where they are and who's with them because they are, again, just not oriented to now? Time of day can be important, in part because of those other aspects like, tiredness, medications, hunger. But for a lot of people, they're going to have points of the day where they are more capable, and then other points where they really need to do less challenging things based on their energy and so forth. And I also want to mention that there are different categories of time, and it's important to recognize that if we have a hyper focus on those ADLs, which are all just kind of about keeping our body functioning, we may be missing out on opportunities to have meaningful activities in leisure or productive time. So somebody really may value the opportunity to sit outside, look at the fall leaves, and that would be more leisure time. So really making sure that our approach is geared towards the category of time that person would be understanding themselves to be in at that moment. So again, like Teepa said, this is complicated. And even if you have 60 years of marriage to this person with you under your belt, it can still be difficult to really parse out what's going on. So hopefully some of these are some additional things to think about. So next we're going to look at a couple more video demonstrations for these ADLs. Again, I don't want to focus on ADLs to the exclusion of everything else in a person's life, but often in talking with family caregivers, staff members here at CJE find that these are areas where people really have a lot of frustrations and feel like they need some more help and training. So I'm going to go ahead and stop my slides here and pull up the video next.
So here's a meal. So you right-handed or left-handed?
Right-handed.
Right-handed. Okay, so turn this way a little bit so everybody's going to be able to see us. Now, before I had you do hand under hand, right? Now what you're going to learn how to do is be the fine motor when they're losing it. The tool manipulation. So the reason I want her hand is her brain remembers her hand coming to her mouth. The reason I need my hand is she doesn't know how to manipulate a toothbrush anymore. So what I'm going to do is do the toothbrush. She is with me, and by being over here to the side, guess what? She literally thinks what? She's brushing her own teeth. Notice that I have my hand on her shoulder applying downward pressure. I'm tricking her mouth into not paying as much attention. Now you notice Mosie's a little bit tender around here. She's not real fond of this. But let me take away the hand and watch what happens. Much more intense because I'm actually tricking her brain. This is close and it's proximal, and so I'm actually tricking her brain into paying attention to the pressure on her shoulder. Now watch this. So does it make a difference? Yeah, so I want each of you, and here's the deal. If you're going to be really good at this, you have to master both sides because you will have residents who are opposite dominance of you. And it doesn't matter what your dominance is. You have to use their dominance unless they've had a stroke, and you may have to use the remaining side. The reason you want their dominant side, that's where all the brain history is for fine motor tasks. Only one half of your brain has learned fine motor skills. The motor memories are not available on the other side. And so I've got to be on this side. It's also where it's going to draw her eye. Search and rescue will always tell you if the right person is right-handed, they'll make right-hand turns. If they're left-handed, they make more left-hand turns. It's an automatic behavior of the brain. So she will look at me more and pay better attention if I'm on her dominant side. So with your partner, give it a try. Try it out.
Okay, so hopefully that had some new ideas that you hadn't tried already for toothbrushing. Again, just a couple of key points to emphasize. We want to use the person's dominant hand. It's going to make it easier for them to access the memory of doing it themselves, as well as help them pay more attention when you're on that dominant side. She used the phrase hand under hand. You're going to see another demonstration of that, but the idea is really that you are holding their hand in yours and you're doing the toothbrushing together. And then again, the idea of having the hand on the shoulder to make everything a little bit steadier and to have them be a little bit less focused on the fact that you're moving that toothbrush around in their mouth. And then again, the other kind of overarching piece with all of this is we're trying to have the person living with dementia as involved with all of these things as possible, right? The idea is not that a person isn't as good at brushing their teeth anymore because they've lost their fine motor skill. And so now they have to have someone else do it for them, right? We're using the term care partner because we're really trying to find ways to work as a team to get these things done. And again, give that person as much control, as much agency as possible. That's going to be more comfortable for them. It's going to be more comfortable for the person who's assisting. All right, now we're going to watch another one that has to do with bathing.
I need to be on the dominant side of the individual because that's where they have motor memory for doing all kinds of tasks. They don't know how to use their other hand nearly as well. So what I'm going to do is I'm going to get on this side. Now, hold hands like you normally hold hands. Shake hands like you normally shake hands. Go ahead and shake somebody's hand. And realize there's nothing real comfortable about that. I mean, once you shake hands, then it's like, okay, let go. And what we can end up with is a tug of war. Or late in the disease, people with dementia often like a lot of contact, and they'll squeeze you and actually hurt you, and it's like, ow, 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 ow. And where are you going to grab to get them loose? On the wrist, and what you're going to do is bruise them again. Shake hands, but then immediately slide up around so that what you're doing is holding on palm to palm, thumb to thumb, and you've got a lot of palm contact. Try that with your partner. And then turn it so their hand is on top of yours, and just relax the hand so that it's very clear it's relaxed. What you're doing is you're putting pressure in the palm, and pressure in a human being's palm calms them down. So what you're actually doing is helping to calm them even while we're doing things, because I'm giving them input into the sensory system. Okay? The other thing that I can do is take the other hand and lay it on top of the hand. And what I'm creating is artificial warmth and padding. What are they missing? Warmth and padding. So all of a sudden we're feeling more comfortable. Now there's a big difference between me being down here where she can see me, because remember the visual field problems? What happens if I'm up here?
Like, no, I just see the...
Yeah, and what if I face her like this? What she's going to start to do is mess with me here, or she doesn't realize what I'm doing, and it feels to her like I'm bossing her around. So I want to either sit down or get down so I'm at her level and she can really look at me. The other thing I can do, by applying just a little bit of pressure, she'll automatically look, and now I can talk to her. I'm going to help you get washed up.
Okay.
Okay? Good. Listen, let's take your shirt off. There you go. Now, that's a little less distressing because she understood what I was doing by being to the side and having a single person in the room. And I'm not being loud, I'm not being noisy. What else do you think we need to think about doing in the room, given that she doesn't have any insulation and I'm about to have her come out of her shirt? Get it really warm. Who's going to need to be sweating? Me. I need to be hot so that when she comes out of her shirt, she's not uncomfortable. Because if she is uncomfortable, is she going to want to take more clothing off? No, because she's cold. Here's the next thing we're going to do. I'm going to take a warm towel fresh out of the dryer and drape it around her shoulders. Now, when I do that, what happens to her exposure in the front? She's covered, she's modest, but what can also happen, she's warmer. Then what I can do is wet her through the towel. I don't even need to take the bra or the under things off yet. Let her keep some modesty, because once you get your clothing wet, what do you think most people want to do? Take it off. Take it off. And if I haven't had a battle up to now it makes sense to take those off. Okay? Here's the other place I want to put a towel. Across the lap. Why? That's the other modest place, and that's another place that's real sensitive.
Okay, so hopefully that also provided some additional new ideas about bathing. So again, just a couple of highlights there. Using those towels for not only the modesty, but also the warmth. If you have a shower chair in your home where the person living with dementia can sit down, using one of the extendable shower heads too, that has like the hose attachment, can be really helpful, can allow the person to be a little bit more independent. And again, using visual and verbal cues before attempting to take that person's clothing off, right? If somebody came over to me and just started to try to take my shirt off, I would be hitting at them and trying to get them away from me too, right? So by really communicating more slowly using those visual cues and the verbal cues prior to the touch, it's going to feel less, possibly fear-inducing for the person. So again, if a person doesn't start the task by becoming frightened and agitated, the whole task can go more smoothly. All right, we're going to watch another one now about eating.
That was good. There you go.
Never saw her open her mouth that big.
Yum. It's because her hand is coming to her mouth versus you poking her in the mouth with your spoon. And her brain going, whoa, what's that? Oh, wait a minute. Oh, okay.
Yeah.
Oh, it's okay. And this is like, oh, okay, I'm eating. Got it. That's pretty easy once I know what it is. Here you go.
Wow.
Isn't that fun?
Oh my.
Both of you are going to have a better time. And what I'm doing is supporting under her elbow. And so that gives her a little added information. And when I do that, she can sit upright a little bit better too. And I can judge.
Is this not amazing? I get thrilled when I learn something new.
Isn't that fun? Yeah. We're going to try the same thing with Miss Francis a minute and see if she's okay with it. See if she likes it. She eats fine right now, but time will come. Is it good, Lucille? Do you like chili? It's pretty tasty.
Wow.
There you go.
Okay, so again, similar ideas demonstrated in that video. She's using that hand under hand hold to help with the eating task. So not trying to just do it for her, but also not just saying, okay, well, she's got to try to eat. It's like, no, she's not able to anymore. Again, with dementia, that person's brain is dying, and we need to recognize that they are not going to be able to do some of the things they used to be able to do. And so giving them the right amount of support to be able to successfully complete the task is, what it's all about. All right, I'm going to go ahead and share my slides again now. Oh, I'm sorry. We have one last video before we go back to the slides. This video is about getting dressed.
Over top. Let's say we have someone who likes over top and doesn't have the opening in the front, an overhead shirt, an overcoat sweater. So what we're going to do is something a little bit different but similar. Same concepts, and what we want to think about this time is that we're going to want that shirt above the arms and the head goes through last, unlike what most folks do. What we do is we put the head in, no, it's okay, and then we try to get both arms down. Come here, Anna, hang on, no, wait a minute, here, let me get you, wait, here. And so what we end up doing is doing battle, where if they have binocular or monocular vision, they can't even see what's going on with the hand and the holes, and they're trying their best, and it feels like we're fighting with them. So what we're going to do is change the sequence. And instead, much as we did before, we're going to start off with the shirt here. I'm going to reach up the sleeve, just as I did before, if the fingers are a problem. I'm going to offer hand under hand, and I'm going to get in this position, bring it through, and now I'm actually going to make sure it's above the elbow on this side. Come around, I'm going to do the same thing on this side. Reach up through, get all the way through, and then hand under hand, arm in, pulling it up, The other nice part about this is if they have a long sleeve on, I can actually hold on to the cuff of the sleeve so it doesn't slide up as well. So I'm just doing the extra layer on. I've got this all the way up. Now what I'm going to do is use hand under hand. Oh, look. What happens here is she doesn't ever not see what's happening. She doesn't feel blinded by the shirt. And this is a real normal movement. And with just a little shoulder, and she spontaneously started to pull it down herself. So do I need to do as much with the hands? It all depends on the person I'm working with. But the idea is we get the shirt above the elbows, open the head up, and the head goes in.
Okay, so that was the final video that we wanted to watch today to demonstrate some of those ADLs. I'm going to go ahead and pull up the slides again while I make a couple of comments about it. So one of the things that I love about Teepa Snow is that method of putting on a shirt is something I never would have thought of. However, I've definitely had the experience trying to kind of do this battle with someone where, you know, from my perspective, it's very clear and simple what we're trying to do is put the shirt on over their head and get their arms through. But that obviously wasn't the way that it felt to the person who I was trying to put the shirt on, you know, and that's why it turned into a struggle. So again, I really hope that people are going to leave today's presentation with a couple of new ideas, a couple of new tricks to try out and see if they work. The other comment that I would make about, you know, each one of these videos is that these, while they can be, you know, simple to implement, they do take time, right? And so when she was helping the woman eat chili, you know, that was not an opportunity for Teepa to also have her lunch, right? Because Teepa was actively involved. So let's say you're the spouse of a person living with dementia. Well, the idea of sitting down at the table together and both having your meal, that may go out the window, you know, if the person really does need that hand under hand at this point in the disease progression to successfully eat. Number of other things like that where it's important to plan adequate time and to just have realistic expectations that you're going to need to do things differently than they were done in the past. And again, that's great that Teepa is giving some ideas and specific strategies on how to do it differently. But on the other hand, it can be hard if you we're used to doing it one way and now to do it a really different way. I recognize that change is hard. And again, you've probably already involved in that process if you're a care partner for someone living with dementia, and you know that change is hard because you have someone who's changing in front of your eyes. But again, it's one of the things that Teepa does that I think is helpful is focuses on what the care partner can do. You know, how can we provide support differently, as opposed to expecting that this person with a progressive disease is going to, you know, spontaneously be able to do things the way that we want them to do them. You know, that's a recipe for disappointment. Okay, so we have those video clips in case anybody wants to watch those again in the future. So a few other tips that I'd like to share are just keeping to a daily routine and having tasks be as predictable as possible. As long as the way that you're doing things is working, keep doing it that same way. Take the guesswork out of it. Use the same visual cues, the same words. Be clear. And if what you're doing isn't working, maybe have another person come over as a set of eyes, and they might be able to help you brainstorm some new things that you haven't been able to come up with on your own. Again, just a couple of words about meaningful activities. They really can make a critical difference in a person's health, well-being, and quality of life. And when we think about the environmental press model, we need to be conscientious that, you know, something that worked well for them a month ago or a year ago, that may be too demanding now. And likewise, if they're offered activities that are not challenging enough, they may feel insulted or demeaned, and they may not engage with those at all. So finding that sweet spot where a person is able to be successful and feel engaged and have a sense of accomplishment is really important. Again, the areas where a person is probably going to need the most amount of support are at the beginning and the end of the activity. So for example, if a person likes to do crosswords, for them to think, oh, right now I'd like to do a crossword. I'm going to walk over to the shelf, pick up the crossword book, get myself a pencil, sit down at the table, turn on the light to make sure I can see well, put on my reading glasses. All of that planning in order to do the task may be too much. So maybe a care partner needs to do that part and guide the person to the table for them to then decide if they do want to engage in that activity. Usually the doing part is where a person with dementia is going to have the most skills remaining. But then with that ending the task, again, they're going to need some more help. Alternating between things that a person likes to do and that a person doesn't like to do is a good idea, helps keep them motivated, keeps them engaged. And again, I would really encourage an occupational therapy consult to help identify what are those tasks that are going to be most appropriate, and that again, the person's going to be able to have that accomplishment and feel good about having done. This sort of a schedule might be helpful, again, using as many visual cues as possible. Just a quick summary here before we move into our discussion portion. Again, that environment is really important. Preparing and just scheduling enough time so that when you're in the bathroom, you've got those warm towels already. So you're not leaving the person in the bathroom, running to the dryer to get the towel, coming back. In the meantime, they've wandered out of the bathroom, and so forth. Set yourself up for success, just like we're trying to set the person living with dementia up for success. And again, really, it can be hard for some of us, but not taking over and seizing control when the person with dementia is trying to do it, and rushing, those are not going to be your friends. And again, if what you're doing isn't working, don't take it personally. Try something different. So like we said, visual, verbal, then the touch cue. And really, as a partner, we want to match the support that we're giving to use the person's strengths and their interests and their abilities, and really let that person shine. And again, on the basic level, using the dominant side to cue their muscle memory. All right, so again, we want to think about what the person is telling us with their behavior. So we're going to be a detective rather than a judge. And we have some resources here. Again, I'm not going to spend too long talking through each of those in order to save some time for the questions that you can do in the Q&A feature. And if you have follow-up questions, you may contact Roseanne, our manager of counseling services. And I'm going to go ahead and stop sharing my slides now, and we can have a few questions.
I just want to remind folks, great presentation, Christie. Thank you. We only have 2 real questions so far in the Q&A, so I think we're going to have time. If people are on the program and you do have something you want to know, go ahead and put that in the Q&A right now. Otherwise, we want to get to a question that came early in the presentation. Christie, the question is, do strategies for dealing with a person with dementia work for people who are having delirium?
So that is an interesting question. I think it would depend on the strategy. Typically, a person is not going to be living with delirium long-term the way a person with dementia would be. So you wouldn't have that same opportunity to observe their behavior and try different things and tailor the approach. But certainly, I think using visual cues and then a verbal cue before you touch the person is going to be helpful. If the person is having any sort of hallucinations with the delirium, thinking about what's going on in the environment. So like we were talking about, reflective surfaces or other, maybe through the window, like if you're in a hospital setting, maybe they can see the ambulance lights coming in, and that is increasing agitation, right? So I think some of those things about really being mindful of the context, those 6 pieces of the puzzle are going to help. But some of those other strategies like hand under hand and using the person's dominant side, sure.
And I just wanted to point out that several months ago, we had a great presentation on delirium. So if anyone is unclear about what delirium is and you feel like you just need some more information, don't hesitate to go on to our Insights on Aging's recorded programs. Margaret Danilovich did a great presentation on delirium, and you can get more information on that there. The other question in the Q&A, Christie, is how about the person who refuses help and believes she needs to wear control top pantyhose and a bra every day? How would a care partner intervene in that situation?
Yeah. So I think that is a really common frustration, is that a person who, from someone else's perspective, clearly needs help is unwilling to accept it. So I would start by thinking about, how is the help being offered or framed? And, is there a way to do that in a way that is less threatening, or that is, really recognizing all the strengths that this person does have, so that she may feel less defensive. So some things like that. And again, that kind of has to do with the 6 pieces of the puzzle as well. Who are the stakeholders in the situation? What is that individual's relationship with each of the stakeholders? Maybe is there someone else who seems more like a neutral party who is able to make suggestions or offer help that might be more successful than a family member? So those might be some different strategies to try. In specific regards to their clothing, it's interesting that was mentioned, because something that's frequently mentioned is like, make things easier. Like instead of having control top pantyhose and pants with a zip and a button and a this and a that, put on a pair of sweatpants, right? Like make it easier by modifying those external things like clothing, so that life doesn't need to be such a struggle. So yeah, control top pantyhose are definitely not something that I would be saying it would be an easy element in this. But certainly, again, when we go back and we think about that individual, their life history, the roles that they have had over their life, perhaps having that physical appearance that is, what they deem acceptable and appropriate and necessary, is really important. And so even if it's not important to one of the care partners, if it is really meaningful to the person living with dementia, maybe that's something we compromise on, and we spend less time and energy on, cooking really beautiful meals, right? If that's something that they don't value as much. All right. I think we all make trade-offs like that in our lives, and a person with dementia is no different.
Another question is, how do we respond when someone says they don't care about anything?
Well, that immediately brings to mind again this need to distinguish between depression, delirium, and dementia, because some of those symptoms are overlapping. And so while a loss of interest and a reducing in some activities is normal with some forms of dementia, it's also one of the symptoms of depression. And so one of the things that I would encourage this person to do, if they say they don't care about anything is see a healthcare provider, see if depression could be the underlying cause there rather than the dementia, and seek treatment. Again, depression is treatable. And so I would say start there for a differential diagnosis. Additionally, maybe that occupational therapy consult would be helpful to try to identify something that the person does care about. When we think back at the person's previous interests and activities and so forth, if it seems like, oh gosh, this person was an accountant, but is not able to do math anymore, so now there's nothing that life can offer. Well, maybe we need to get a little bit more creative. And again, thinking, it just keeps coming back to that idea of all of these different pieces because it is complicated. Maybe there are things about, the sleep schedule, the medications that could be having this as a side effect, this kind of dulling. So yeah, I would definitely try to work with healthcare providers and others involved in the situation to see if something can be modified to get that person's quality of life improved.
Wonderful answer. We're gonna take one more comment from the Q&A and then we're gonna wrap up. But I really appreciate this. Someone participating in the audience went back to that last question and is making a suggestion about the pantyhose, the control top pantyhose, which was something I had in my mind as well. She's asking if it might not be appropriate to try kind of a trade-off, something like moving to tights or leggings. I was thinking maybe trying to move to a larger pair of pantyhose. Could you find something that's more comfortable, that's more of a trade-off? I'm sure that the care partner in question who put this in has probably tried some of those, but I like that idea of a gentle movement towards more forgiving clothes, if you can make that a gradual change out. I loved your answer,
Right.
though, that respecting who this person was is so important. And with that, unless Christie, you have more, just another comment or want to wrap us up, I wanted to make some parting comments. Do you have anything else, Christie?
No, I appreciate people participating today and I appreciate everyone's time. Thank you.
Okay. And definitely, we want to thank you, Christie, for taking the time to do this presentation, loaded with content, especially with the two programs together, which people can see. You can access this on our website, and I'll give you directions to that in a minute. But I wanted folks who are participating live today to know, as you're leaving the program, a survey will appear. You're going to be asked for feedback on this program, as well as if you can give us some ideas for future programs. We'd love to hear what content you're interested in receiving. If you have the time to fill out the survey, thank you. And in about a week, today's participants will receive an email that'll have a link to the recording of this session, as well as the whole PowerPoint presentation as Christie presented it. Please be patient. It takes us a little time to edit the video, and we only want to send one email. So we put everything in one email, but do give us about a week to get this to you. And I want folks to know this program, the other programs that we're recording every month are available on the CJE Senior Life website. You can go to our counseling services page. And then we have a page that's actually called Insights on Aging Resources. So that's where you'll find all of this rich content. Thank you again to everyone who signed on today. Thank you to Christie. I've really enjoyed the conversation, and I'm so excited we're going to have this for others to view in the future. It's really great. Thank you all.